Welcome back. Now, high-pitched drama ensued both inside and outside of the Delhi Assembly on day 4 of the session. The BJP government tabled the CAG report on healthcare lapses under the previous Aam Aadmi Party government, and the reports have exposed glaring irregularities in the government hospitals and Mohalla clinics during the previous regime. And among the biggest talking point is the lack of toilets and drinking water in several of Mohalla clinics, which was the flagship health scheme of the Aam Aadmi Party. The report also highlighted lack of medicines, amenities and staff in multiple government hospitals that were audited.
This is the report where it's saying you have done a corruption in this health sector also. You have not left in the name of COVID. You have done a corruption. In the name of Mohalla clinic, you have done a corruption. In the name of making of a new hospitals, you have done a corruption. In the name of, CAG ambulances, you have done a corruption in that. What are you expecting? Delhi people should see this report. And today, as a Delhiite, I'm ashamed today. In the name of COVID, when Government of India has given 600 odd crore rupees, you have not spent 345 crore rupees. And you are claiming that Modi is not helping in the COVID days. People were dying in Delhi. You are not spending the money also, which has Government of India has given to you for in the name of PPE kits. Where these PPE kits have gone?
Now, even as the glaring lapses under the Aam Aadmi Party regime were being highlighted inside the assembly, there was high drama outside it for the second running day. Leader of the opposition, Atishi, and the Aam Aadmi Party MLAs were stopped from entering the complex given they have been suspended for the remainder of the session. The Aam Aadmi Party attempted to march towards Rashtrapati Bhavan to raise their voice, but they were stopped by police barricades as well.
भारतीय जनता पार्टी ये मानती है कि ये देश बाबा साहब अम्बेडकर के संविधान से नहीं चलता। भारतीय जनता पार्टी इस देश को मोदी जी एक नया संविधान देने की कोशिश कर रहे हैं, एक तानाशाही का संविधान देने की कोशिश कर रहे हैं। इसीलिए तो ये बाबा साहब की अम्बेडकर की फोटो हटा के मोदी जी की फोटो लगाते हैं। इसीलिए जब भारतीय जनता पार्टी मोदी 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 के नारे लगाते हैं तो उसमें कोई दिक्कत नहीं है, लेकिन जब आम आदमी पार्टी के लोग जय भीम के नारे लगाते हैं तो उनको निष्कासित कर दिया जाता है। जब अब संविधान को बचाने के लिए हम संविधान की परम रक्षक इस देश की राष्ट्रपति से मिलने जा रहे हैं तो हमें यहाँ पे रोक लिया है। राष्ट्रपति भवन के बाहर नहीं रोका, दिल्ली विधानसभा से 10 मीटर की दूरी पर रोक लिया है। कोई आदेश नहीं है, कोई लिखित आदेश नहीं दिखा रहे हैं।
And for a reality check, a Times Network visited Mohalla Clinic to take stock of the situation on ground and speak to people at large. Take a look at this report.
The draft CAG report of health of the previous Delhi government highlights the loopholes in the health sector. It also highlights that how the conditions of Mohalla clinics were deteriorating. And in fact, to have a ground check, to have a reality check, we have reached one of the Mohalla clinics. However, surprisingly, you can see that this particular place, which was supposed to be a Mohalla clinic located near Rouse Avenue, has now turned into a godown, a storeroom of the vegetable vendors. However, you can also see the posters of Aam Aadmi Party, the small posters that have been pasted over here, on which it is written that "Kaam hi hamari pehchan hai." And ironically, you can see that what's the calm that's been done by Aam Aadmi Party over here. Mohalla clinic that was supposed to have, doctors, a proper medical facility, medicines and all of the equipments, that is now filled with all these, storage material of the vegetable vendors. And they have been telling us that, this particular place has been in this condition since past many years, and no government has taken, and Aam Aadmi Party government particularly has taken no cognizance of it. भैया मोहल्ला क्लिनिक यहाँ पर कितने समय पहले से था?
मान के तो 3-4 महीने का तो 5-6 साल से बंद पड़ा हुआ है।
बंद पड़ा हुआ तो पहले यहाँ पर इलाज होता था, अब ये बंद हो गया। कोई आया कभी देखने आम आदमी पार्टी से?
जब से बंद पड़ा हुआ है, जब से ये बनाया भी तो बंद ही हो गया।
अच्छा, तो आम आदमी पार्टी से कभी कोई आया देखने यहाँ पर, कोई जांच करने आया यहाँ पे?
नहीं, देखने के लिए देख के चला गया था। आज खोलूंगा, कल खोलूंगा, ऐसे करते करते खुला नहीं था।
खुला नहीं कभी भी। अच्छा, आप
तो बहुत क्लिनिक वाला बना हुआ है, दिल्ली में शहर में कम 500 से ऊपर बना हुआ है, कोई खुला नहीं है।
And to discuss this further, I'm joined by an esteemed panel of guests this evening. I'm joined by Mr. Pradeep Mahaur, a senior leader of the BJP, and Dr. Piyush Joshi, Aam Aadmi Party spokesperson. Good evening to both of you. And thank you for taking your time and joining us over here at Mirror Now. I will first go across to you, Dr. Piyush Joshi. Was it all a hogwash? Because when we hear of Mohalla Clinic, we are immediately reminded of the statements of Arvind Kejriwal, who promised it to be a revolutionary move on their part to ensure accessible healthcare for people of the national capital. But now that the CAG report and the finer details are coming out, it appears that it was all a smokescreen. I would like to just cite few examples of it, where the report uncovers the troubling findings, with 70% of patients were given consultations lasting less than a minute, and a shocking 18% of the clinics were rendered non-operational, with 41 out of 218 clinics closed during the audit due to chronic shortage of doctors and having administrative issues. Dr. Piyush Joshi, do you have anything to defend for the Aam Aadmi Party? And if so, why don't you do it inside the assembly when it's in session?
Okay. So, let's take the things at their face value. Your correspondent visited one of the Mohalla clinics, whether it's there on the list of the functioning Mohalla clinics or not, a lot needs to be answered upon that. The thing is, my perception is that the problem with Mr. Arvind Kejriwal and Aam Aadmi Party's Delhi government was that they thought of primary health care and school education system, and that to good quality, in a country where no one thinks in the similar manner. Why? Because I have examples to that. If Mohalla clinics were so bad, why did the Madhya Pradesh government, which is the Bharatiya Janata Party government, try to copy its model? Why did the Andhra government try to copy its model? Why did the various governments, and mind you, Madhya Pradesh government has not opened even one Mohalla clinic as yet. And even they named it Sanjeevani Clinic. How many of them are functional? Look at it from that perspective. Now let's do certain amount of reverse engineering at that. Let's say whatever the Bharatiya Janata Party is saying is true at its face value. All the Mohalla clinics are sham, hogwash, a smoke screen, as you said. Close down all the Mohalla clinics. Now, if a person is coming suffering from some common cold or some fever or some urinary tract infection or an upper respiratory tract infection or a diabetes or a hypertension, where is he going to go? Do you have any answers? So primary healthcare is the answer. 1 rupee spent on primary healthcare is 10 rupees saved in secondary and tertiary healthcare. So that is the problem with Mr. Arvind Kejriwal, that he dared to think upon providing primary healthcare, that to good quality primary healthcare and good quality school education to those who cannot afford it. It has led to the reduction of 33% in the OPD footfalls in the busier hospitals of Delhi. And that is why it was praised all along. But administrative hassles, as you yourself said, that there were a lot of administrative hassles being faced in the smooth functioning of Mohalla clinic. Why? What happened? Why these Mohalla clinics are being run in rental premises? Because the DDA and the LG, of course, the office of LG and the DDA refused to grant them land. Forget about everything else. In the history of independent India, through your channel, Samia, I would like to ask, which other innovative model for strengthening of primary health care this country has seen? In last 70 years, we got independence in 1947. The PHC's commission were established well before we were granted independence. Is there any other model of primary health care we have seen through state governments for urban centric population? Did we see anything? If someone has any answers, if not Mohalla clinic, then what? Please tell me. Are they perfect?
But Dr. Joshi, there is a difference. There is a difference between ideation, Aam Aadmi Party's pet project, and the execution of it. What we are talking about is the execution. Was Arvind Kejriwal a visionary? Was this a brilliant idea? We are not questioning that. But when it comes to the execution, if there are gaps, then let's accept and acknowledge it. And then we can perhaps address where the
Agreed.
gaps were. But in the first place, Aam
Absolutely.
Aadmi Party will have to accept the fact that there were flaws, there were gaps, and it is all right to accept that. And let me take the question across to Mr. Pradeep Mahaur. You know what Mr. Joshi over here is trying to say, that if Mohalla Clinic was a flawed project, why was the BJP-ruled governments or the allies of the BJP trying to replicate it in their respective states? What he's also trying to ask you is that, was administrative gaps in some way orchestrated? Because there was the LG, who the Aam Aadmi Party always maintained was trying to act at the behest of the government. Mr. Mahaur.
First of all, I heard the spokesperson, and what he was saying that this was some kind of a unique project by Arvind Kejriwal or Aam Aadmi Party. First of all, there are similar kind of projects running all over India, right? Where there are small clinics, right, which are run. So name can be innovative. There can be different names, and Aam Aadmi Party is very good at naming things and advertising it properly. So they advertise it nationally as well as internationally. So, but as far as this project is concerned, whatever project you are running, first of all, you need to run it properly. And what happened to the project, I'll tell you now. And it's actually shambolic for Aam Aadmi Party, even spokespersons and everybody who must be listening to this debate. 57, he's a doctor now, 57 Mohalla clinics, as per the CAG report, were not having a glucometer. What the hell the doctors were doing? 45 were not having X-ray viewer. So if somebody has met an accident and he comes with an X-ray from somewhere outside and tries to enter into the clinic and he wants his X-ray to be viewed by the doctor, there is no X-ray viewer also. 18 clinics were not having thermometers. Such basic kind of a thing. So even 2 Mohalla clinics were found where there was no stethoscope. Understand? If somebody wants to, act like a doctor, he'll just carry a stethoscope. 2 were found where there was no stethoscope. The condition is so pathetic. These people are still claiming that this was one of the best strategy or best kind of a innovative project that they have. How you are running the project, that is most important. If you are running the project is a complete failure. You have done this kind of a mess. And he was talking about the budget. I'll tell you. During COVID period, 781.95 crore were issued to Aam Aadmi Party, means Delhi government, right? That time. They utilized 582.84 crore. 200 crores were unutilized. That 200 crore. Or not only this, they are talking about women. I'll give you some data. In maternal health, the expenditure, 98% of the funds were unutilized. What the hell they were doing there? They are talking about public health. They should feel shame about it that they could not even utilize those funds that were given by the central government to them for welfare of the people. 98% of the fund unutilized. That means they were just playing around. So what they could have done is, he was talking about the land that not given by LG. The similar kind of answers they had earlier also. LG did not do this. LG did not do that. They could have utilized this 200 crore amount to purchase, 200 crore amount is good enough.
Dr. Joshi, please respond to the charges that Mr. Mahaur is making. Now, these are basic prerequisite at any clinic or a hospital, whether as far as stethoscope and thermometer. Now, all these are findings of the CAG. Now, what the BJP is saying, and these are the exact reasons why the Aam Aadmi Party never really wanted the CAG report to be tabled before the elections. And now that the CAG report has been tabled, if the Aam Aadmi Party has to defend its Mohalla Clinic project, why are they not doing so inside the assembly?
First and foremost, thank you for having this debate, because it's really, it makes me happy, it makes my heart swell to see the BJP spokesperson talk about healthcare for once, because this is what we need to be talking about day in and day out. Now, let me explain what happens, You cannot run
Dr. Joshi,
certain
what
clinics
Mr. Mahaur is asking is that why wasn't the fund utilized?
Just hold on. That was for COVID, right? So it's a different ball game altogether, and that's a different debate for that. That was not meant for Mohalla Clinic. Number one. So when you talk about COVID, sir, I did not interrupt you. I heard you patiently, though I disagreed with lots of points that you made. So, it was for COVID. So when we talk of COVID, we will get into PM cares, which is another different ballgame altogether. Whether it's an NGO or whether it's a government entity, nobody knows. Till date, no CAG audit has been done as far as PM cares is concerned. When you're talking about CAG audits, let's discuss the CAG audit of Madhya Pradesh. Let's discuss the CAG audit in the healthcare system of Rajasthan. Let's discuss in the healthcare system of Assam. He's talking about maternal mortality, and the maternal and healthcare fund. So when you're talking
Dr.
about
Joshi,
the maternal
passing
and child
the
health,
buck or trying to pin the blame
not
on the
passing the
other
buck,
state
not passing
doesn't
the
absolve the Aam Aadmi Party of its responsibility.
I am explaining, Ms. Kapoor, through your channel, what Aam Aadmi Party government did in last 10 years. When you talk of maternal mortality, and that's why, because you are debating on healthcare, that's why I'm giving you hard data. The national average of Delhi's women when it comes to maternal mortality is much less than the national average. Forget about all other BJP ruled states. Take the state of Gujarat, Madhya Pradesh, Assam, Rajasthan, whichever state you want. It is going to top. It is going to be more than the national average. When it comes to the neonatal mortality, that is बच्चों के मरने की दर जो होती है या छोटे जो नवजात होते हैं नवजात शिशु मृत्यु दर जो होती है, even in that, the Delhi is doing much better than the national average, whereas all the BJP ruled states are doing much worse than the national average. And the top on the top of the list is Assam. Aam Aadmi Party is not there. Second number list, in neonatal mortality, maternal mortality is Madhya Pradesh. Let us presume my stethoscope is dysfunctional. I am sitting in Mohalla clinic. I am a doctor. My stethoscope is dysfunctional. I'll raise a report that stethoscope काम नहीं कर रहा है. I'll raise an invoice and I'll wait for the supply to come. Meanwhile, what I'll do? Will I function without stethoscope? No, sir. I will bring my own stethoscope because I'm a doctor and I'll function in between. And that's how it all runs. But also, Mr. Mahaur said there are many projects like this, where urban-centric work is being done. Mention one. Forget about Mohalla clinic. Mention one in Delhi. I asked a very pointed question. Close down all the Mohalla clinics. They are bad, na? Close down. Where is the patient going to go if not for Mohalla clinic? Are they going to go to your urban CHCs, or are you going to flood the OPDs of the already burdened hospitals? So it is easy to create hindrance. It is difficult to give ideas. Forget about elsewhere. Give one example in last 70 years all across the nation where an urban-centric primary healthcare project like Mohalla Clinic has been declared or has been run either by Congress or by BJP government. Name one. I challenge you on this program. So it's easy.
So,
to,
Mr. Mahaur,
is the system perfect?
essentially
Maybe
Dr. Joshi is trying to ask you is that if Mohalla Clinic is a flawed project, and since the BJP is trying to read the CAG report threadbare in the assembly, has the BJP government in Delhi decided to do away with Mohalla Clinic? Will you clamp down on Mohalla Clinic? What is the way forward here on? Will you be acting on the CAG report and ensure that all the gaps that were there earlier during the Kejriwal government does not get repeated this time around? The same mistakes, the same fallacies. Or are you planning to put an end to Mohalla Clinic? That is what Mr. Joshi is trying to ask you, is that, okay, if you feel Mohalla Clinic is bad, you can do away with it. It's your government now.
Look, I just told you that, I don't know how he put fingers like this, but I told you the similar kind of projects are going on all over India. If you go to a small village also, you'll find some kind of a clinic, working for public welfare. So it is not an innovative project. First, we need to understand. Second, as he was saying, that if you do not have a stool, you sit on the ground and start testing the patient. So this is a kind of comic statement given by the doctor. I was really surprised that I gave such kind of a data where even thermometers are not present. So doctor will carry a thermometer, doctor will carry a weighing machine, doctor will carry a X-ray viewer, he'll carry a glucometer with him, BP machine. What kind of a doctor are we expecting? Right. Are we expecting doctor to go with a trolley into a Mohalla clinic kind of a place? Surprising. Well, what a surprising kind of analogy these people are giving.
Okay.
As far as Mohalla clinics are concerned,
no, points taken, Mr. Mahaur. I have paucity of time. I will have to have this conversation over here. Yes, there are glaring loopholes and the CAG report is damning, but what is going to be the way forward now? Will the BJP government in Delhi now continue with the Mohalla Clinic project? Are you going to fix the missing links? Well, we will have to wait and watch. Mr. Mahaur and Mr. Joshi, thank you for taking your time and joining us over here. I will have to wrap this conversation over here. And with that, we are slipping into a short break right now. Lots more lined up. Stay tuned and keep watching Mirror for more news and updates.